everyone, welcome to this month's Medicare Minute. Thank you so much for joining us. This month, the month of May, we'll be covering Medicare telehealth coverage. Medicare telehealth coverage has been expanded to allow more people to access care at home, and we're going to talk about that more. Before we get started, it's really important for us to be able to define what telehealth is. Telehealth includes certain services that you receive from healthcare providers outside of an in-person office visit. A telehealth service is a full visit with a provider using a telephone or video technology that allows for both audio and video communication. It is different from a virtual check-in or health portal message. Some examples for Medicare-covered telehealth benefits include lab test results, prescription management, health screenings, and other things like that. As we're looking to what we're offering in 2026 and beyond, it's important to understand where we were with telehealth services pre-COVID time. So let's look at what it was like when we had telehealth services before the public health emergency. Medicare telehealth coverage was very limited. Telehealth service was generally only covered in rural areas, and you would still have to go to a specific originating site to receive telehealth. So you probably couldn't have gotten home telehealth care. You'd likely have to go to a different medical office or clinic. Telehealth was generally only covered if it was provided via interactive two-way audio and video technology, and it was limited to certain health providers. As we are looking into understanding what telehealth coverage is now and what we can expect in the future, we definitely want to look at all of the amazing advancements that we've had since COVID-19. So some of those include the fact that all beneficiaries in any geographical area can now receive these services in their own home instead of having to go to a site for this. Also, any healthcare professional that is eligible to bill Medicare can provide and bill for telehealth services. This means you can access telehealth from more providers, like physical therapists or even speech-language pathologists. Additionally, telehealth could be delivered using audio only and doesn't have to require both audio and video. You can be provided by any telehealth provider that can bill Medicare. These flexibilities have been set to expire, but then extended multiple times over the last few years. Most recently, these flexibilities have been extended through December of 2027. So what are some types of services Medicare covers for telehealth? Well, they cover lab, test, or x-ray results, post-surgical follow-up, prescription management, preventative health screenings, treatment of recurring conditions like migraines, urgent care issues like cold, coughs, and stomach aches, mental health treatment, including online therapy and counseling. It's amazing to see the vastness that telehealth services can now be supported through Medicaid. So it's important in your role as the person who is receiving these services to monitor and be cautious of potential scams. Remote patient monitoring allows your doctor or healthcare provider to monitor parts of your health from your home using medical devices such as scales, glucose monitors, and blood pressure cuffs. When medically necessary or properly managed, remote patient monitoring can support ongoing care, help manage chronic conditions, and reduce the need for in-person visits. However, not all remote patient monitoring offers are appropriate, medically necessary, or legitimate. Some companies may try to enroll you in services or send devices that are not medically necessary, not clearly explained, or billed without your full understanding or consent. So it's important to look out for potential scams and warning signs. These offers may come through phone calls, internet ads, or television promotions. So To protect yourself, it's important to confirm that any remote patient monitoring service is recommended by your trusted doctor or healthcare provider, and that you understand how it works and how it will be billed. So look out for some potential warning scam signs. You see charges on your Medicare statement for remote monitoring and you didn't need, you didn't get, or you didn't agree to. You're offered a free device like a smartwatch to track your daily steps in exchange for your Medicare number. Or your doctor office calls and asks how you're doing, and later you notice that there's a bill for a phone call to Medicare as a remote patient monitoring services. So take action now. Ask your health professionals to learn more about telehealth and remote patient monitoring services they offer. Contact SHIP if you have questions about Medicare telehealth coverage, and contact SMP if you think you have experienced potential Medicare fraud, abuse, or errors. And then you can also contact your Medicare Advantage plan if you have questions about the coverage and costs related to telehealth services. Thank you so much for joining us for this month's Medicare Minute, a deep dive into telehealth services. If you ever have any issues, please feel free to call the SHIP office at 410-887-2059, or you can email us at medicareinformation@baltimorecounty.gov. See you next month.